Hi everyone, this is Dr. Prithiavari. Today we are going to see the microscopic structure of a blood vessel. So there will be three blood vessels which we'll be talking about: the elastic artery, the muscular artery, and a large vein. Elastic arteries. These are large arteries or conducting arteries as aorta, brachiocephalic trunk, common carotid artery, subclavian artery. Now, in the wall of the artery, we are going to see in the wall of the artery, there will be three layers: tunica intima, tunica media, tunica adventitia. So, in a section, when you see the picture, when you see the H&E stain slide of elastic artery, you can see a section of a wall of a artery. So, towards the blood, that is towards the lumen of a blood vessel, the first layer will be tunica intima. This layer is made up of simple squamous epithelial cells arranged regularly to form endothelium, which will lie on the basement membrane. Just below the endothelium, there will be subendothelial connective tissue. We can say it as lamina propria. It will be loose connective tissue underlying the endothelium. And deep to that, we can see circularly arranged 2 to 3 layers of elastic fibers. We call it as internal elastic lamina. These three together are called as, or they are forming the first tunics, that is tunica intima. The second layer is tunica media. In the elastic artery, the second layer, tunica media, is quite thick, and there are several layers of perforated sheets of elastic fibers present in this layer. These elastic fiber sheets or their curtains are arranged parallel to each other, and they are circularly placed in rings, in ring like fashion. So in the aorta, you can see from 30 to 100 sheets of elastic fibers present in tunica media. These elastic fibers can be seen purple or pink in color with etany stain. If we want to see the elastic fibers, we need a special stain, that is Van Jensen stain. They can be stained with this stain, it with different color. In between the elastic sheets, some collagen fibers and very few smooth muscles will be placed. What is the function of these elastic fibers? In these big blood vessels, they will allow distension of the blood vessels. So volume of the blood vessel will increase so that it can accommodate large amount of blood as it has to carry blood from heart to the periphery. So these are the conducting blood vessels. The outermost layer is tunica adventitia. It is made up of dense irregular connective tissue, and here the layer is very thin. If you see the ratio of tunica media to tunica adventitia in elastic artery, it will be 3:1. Like tunica media is 3 times bigger than tunica adventitia. The name elastic artery is given according to the layer, second layer, that is tunica media, which has got multiple layers of fenestrated sheets of elastic fibers. Because of these elastic fibers, the name given here is elastic artery. But these are larger in size, so we call them as large arteries also. And they are conducting blood from heart. They are carrying blood from heart away, so we call them as conducting arteries. Now in this picture you can see the low power view, etany stain view of wall of a elastic artery. Now in the center, this is a lumen. So what is A here? A is representing, or A is showing tunica intima. The innermost layer of tunica intima is made up of endothelium, singly arranged squamous cells. You can see it is lying on the basement membrane. Deep to that, there will be lamina propria, or you can say the loose connective tissue present over there. Deep to that, there will be, you can see the first layer of first layer of elastic fibers or elastic sheath, elastic curtain. circularly arranged around this loose connective tissue. This is called as internal elastic lamina. But internal elastic lamina cannot be separated from tunica media. It will merge with the other sheets of elastic present in the tunica media. So in B you can see that is tunica media, which is a quite thick layer. Layers of elastic fibers arranged in circular fashion in a curtain. So these are all elastic fibers circularly arranged. In between you can see some smooth muscle fibers. This is tunica media, and the outermost layer is made up of dense irregular connective tissue, that is tunica adventitia. It has got small capillaries inside to give blood to this layer. These capillaries are called as vasa vasorum. So this is the low power view of elastic artery. Next is muscular artery. They are also called as medium sized arteries or distributing arteries, as they arise from large elastic arteries and distribute the blood to various tissues and organs. Like we have brachial artery in the upper extremity, femoral artery in the lower extremity, popliteal artery, ulnar artery, radial artery. You can call them as muscular artery. Now, in this artery also we can see tunica intima, tunica media, tunica adventitia. Tunica intima is same everywhere, but here the feature is the internal elastic lamina will be conspicuous. It is very promptly seen under microscope. This is the identifying feature of a muscular artery. This is how, with the help of this specific feature, we can differentiate muscular artery from elastic artery. Now, why the name muscular artery? In the tunica media, you can see relatively more layers of smooth muscles in this artery, which are circularly arranged. So the elastic fibers will be very few here, but smooth muscle amount will be more in the tunica media. That's why the name muscular artery. The tunica adventitia will be very thin here. So in the section, when you see it under low power, you can see tunica intima. Now can you make it out? You can see in the tunica media, tunica intima, the internal elastic lamina is very conspicuous, prominently visible. So actually in the slide sometimes you can't even see the endothelium. You can see only the rounded dots attached to this internal elastic lamina. You can't even make out the subendothelial connective tissue. So you can see just wavy outline of the internal elastic lamina just after the lumen. That is the identifying feature of a muscular artery. And in the tunica media, you can see circularly arranged smooth muscle fibers. This layer is also quite thick. Then see the tunica adventitia. The ratio of tunica media to tunica adventitia is 1:1. Their thickness is same. Large vein. The vein which are quite large in them, the diameter will be one or more than that. Here also we can see tunica intima, tunica media, tunica adventitia. But the internal elastic lamina in the tunica intima is poorly defined. Here the tunica media comparatively very thin and less smooth muscle. Let us say only 3 to 4 layers of smooth muscle fibers are present. Sometimes you can see longitudinally arranged muscle fibers in the large vein. Tunica adventitia, it is well developed and it is thickest layer. Bundles of longitudinally arranged smooth muscle fibers are present in tunica adventitia. Vasa vasorum are more in number in the adventitia of a vein because the vein is carrying venous blood, so it can't give nutrient to its own wall, so it needs more small capillaries supplying to its wall. Now why the tunica adventitia is bigger in a vein? If you see the ratio of tunica media to tunica adventitia in a large vein, it is 1:3. Adventitia is quite big. This adventitia provides a space for the distension of a blood vessel which is carrying venous return, the venous blood to the heart. Example is you can see all large veins like superior vena cava, inferior vena cava, the blood vessels present in the leg like great saphenous vein can also be called as a large vein. So in a section, if you see the vein, the lumen of the vein is not circular. Most of the time it is collapsed. You can see tunica intima, tunica media, but what you can make out the tunica adventitia is quite big, and more number of vasa vasorum are present into tunica adventitia. The ratio of tunica media to tunica adventitia is 1:3. So if you want to compare all three together, how can we compare them? In the tunica intima, in the muscular artery, internal elastic lamina is prominent. In the tunica media, in the muscular artery, we can see more number of smooth muscle. In elastic artery, more number of elastic fibers are seen. In the large vein, we can see smooth muscle fiber. The tunica adventitia is quite big in the vein. The ratio of tunica media to tunica adventitia in the muscular artery, it is 1:1. In elastic artery, it is 3:1. And in the vein, it is 1:3. I hope you understood the topic. Please do subscribe, share, and like. Thank you for watching.